Assalamu alaikum wa rahmatullahi wa barakatuh. Sleep being an important aspect to our daily lives. For the benefits it has in our body and mind, millions of people globally are struggling with different types of sleep disorder. That's why today on Health Matters, we're joined by Dr. Macharia, who is an ENT surgeon from Nairobi Sleep Diagnostic Center, that will be telling us more about these disorders and the effects that it has on us. My name is Zainab Abdul Karim, and thank you for joining us. Thank you so much, Dr.
Well, thank you so much, Zainab.
Yes.
Pleasure to be here.
Same here. Before we start, maybe just a brief introduction of who you are and what you do.
Okay. So I'm Dr. Ian Macharia. I'm an ENT surgeon. That's ENT stands for ear, nose, and throat surgeon. I've been practicing for about 5 years now, and as an ENT surgeon, I've done my medical school, I've done my ENT surgery, and I'm qualified, and I practice both surgery and clinical medicine as well. And one of the biggest questions I'm asked is, what is a surgeon doing in a sleep diagnostic treatment center? And the reason we're involved in sleep is specifically something that is snoring or sleep apnea. So that's what we are involved in sleep for. So that's why I'm here.
Yeah, straight to our topic of the day, which is sleep disorders. But first and foremost, what is sleep and what importance does it have to us as human beings?
Yeah, so you'd be very shocked that actually all animals and mammals and even fish, they sleep. So it's very important for us. And sleep is, we don't know the very real reason we sleep, but we know that it's involved in health, it's involved in rest. There are some theories that it helps the body, it helps the brain in metabolism, and other theories in that it helps with repair. So that's why sleep is important, and we actually sleep for almost a third of our lives, so that's very important. And in the new part where health is going, sleep is part of the third leg of wellness. The other two legs of wellness are nutrition and activity, basically being active in your life. So motor activity, yes.
Yes, talking about that, for a normal human being, how many hours are they supposed to sleep? We can start with kids and then adults.
Yeah, so very interestingly, is that sleep, the person who sleeps the most is actually the youngest, and these are children. So in a 24-hour period, a child could sleep up to 20 hours, and then it starts reducing as the child grows older, 18 hours, 14 hours, 12 hours. You find for maybe a 6-year-old child, it goes up to down to 9 hours. And then for a teenager, almost the same, up till an adult who sleeps for maybe between 6 and 8 hours. So it starts very high and goes down. And the reason for that is sleep is super important for the development of the brain. And the development of the brain occurs in two areas of our life. The first few years of life, that's why sleep is super important. And then for a teenager. So those two periods, sleep is very important. But for the child, for the infant, you know that infant less than 1 year, sleep doesn't come in a block of time. Sleep is very fragmented. So that's why they now get into blocks of sleep. Yeah.
So talking about periods of sleep, like the time they're supposed to sleep, what will happen to someone if he or she goes for a long period of time without sleep?
Without sleep. Yes. So let's assume it's for an adult. Yeah. 6 to 8 hours is what you require. There have been documented cases of people who have tried to stay awake for very long periods of time. long periods of time, even days. There's a documented case of somebody who stayed awake for 8 days straight. However, this is very detrimental to your health. And actually, the Guinness Book of Records has removed that as a record. And this particular person, early on, was able to stay awake, but started getting mental issues, body issues, and even at the 8 days was not well. And if you look at his story, he actually, his health, there were a lot of residual effects of that period of 8 days of no sleep. And governments know this, and even if you look at some of the methods that they try and extract information, you see that lack of sleep is one of them. That's actually one of the torture devices. So it's very important for your body.
Yes, our topic of today is sleep disorders. Simply define what is sleep disorders.
So, first of all, I mean, when you think about sleep, sleep is a reduction of consciousness where you also reduce your reactivity, but you're able to get back. Okay, so it's not permanent. So, and it's very distinct from wake. So we have a sleep wake. Now, what sort of sleep disorders are there? We have plenty of sleep disorders. Most people think about sleep in terms of insomnia, sleep disorders in terms of insomnia. That's one most people know about. That siwezi lala, you know. Lakini, there are other types of sleep disorders. The sleep disorders where you have difficulty with breathing. You have sleep disorders where you perform activities that are normal for wake, like sleepwalking, sleep talking. There are sleep disorders where you have difficulty distinguishing, it's called a circadian rhythm, where like jet lag. And you have other sleep disorders where sleep intrudes into your wake time, like narcolepsy. So you're just walking and suddenly you collapse. You know, it's very interesting. And one of the problems with sleep disorders is that medically speaking, it doesn't have a home. So let me give you an example. If you're a child, you go to a pediatrician. So child diseases are dealt with by pediatricians. If you're a woman, you go to a gynecologist. If you're pregnant, you go to an obstetrician. So obstetric diseases have a home in obstetricians. But sleep disorders are dealt by a lot of people. They're dealt by ENT surgeons, they're dealt by physicians, they're dealt by pediatricians, they're dealt by dentists. They're also dealt by psychiatrists, psychologists for obvious reasons. And globally, there's a new field coming up called sleep physicians who come and deal with all these things. So it doesn't yet have a proper medical home. That's why you'll see a lot of us looking at it from different ways and tackling it differently.
Yeah, speaking about disorders, which are the most common ones that you deal with in your center?
So for us in our center, the Sleep Diagnostic Center, a lot of patients come asking about insomnia. However, most of our work is to do with sleep apnea and snoring. That's our biggest work. Because as I said, what is an ENT surgeon doing in snoring and sleep apnea? And the answer is very simple. A lot of snoring problems come from an overcrowded throat. So large tonsils, large adenoids, large tongue, floppy throat tissues. So that is why an ENT surgeon is dealing with sleep. So, and a lot of snoring actually occurs in men. And we call it elbow therapy, where the bed partner ndio anagonga mzee na anamka. So we get a lot of referrals from actually wives saying, this husband of mine or this bed partner is actually snoring, or I've had my father snoring, or had my brother snoring in bed. So they're the ones who bring patients, and we see them and evaluate them and give them options of how to treat it.
So you said the most common one you deal with is
Snoring and sleep apnea. Yes, yeah. So the thing is, most people think snoring is normal. Snoring is not normal. However, snoring is just a hint that you could be having something else. So we look and see if you have something called sleep apnea, and sleep apnea is one of the biggest disorders it's one of the growing disorders in the world. So sleep apnea means that when you sleep, your airway should be open. So unafaa kupumua vizuri. So what happens is that your airway collapses temporarily, giving you symptoms and signs. So what do the patients come with? And they say, Daktari, I'm snoring. But what do they ask for? What else do we find out? They say, Daktari, I feel like I'm choking at night. I feel like I can't breathe at night. I'm waking up a lot at night. I am waking up to go and urinate. So a lot of patients sometimes feel that maybe nimekunywa nyingi, but it could be, you know. And anything that affects your nighttime affects your daytime. So then you will find that patients say, I wake up very tired. I wake up feeling kama sijalala vizuri. Or when I'm at work, I feel like falling asleep very easily. When I'm driving, nasikia kusinzia. When I'm on my computer, I feel like dozing. When I'm reading a book and I'm not stimulated, nasikia very strong sense ya kulala. And they also talk about that is called excessive daytime sleepiness. It's actually a medical term. And they also talk about, because they're snoring and mouth breathing, they talk about they wake up in the morning with a dry throat, or they wake up with morning headaches. So all those symptoms, when we think about them together, they give us what is called sleep apnea. Yes, especially the choking and the snoring at night. Yes, but a lot of patients also come here because of insomnia. How they feel like siwezi lala. That is different, but we do see those patients, but that is not primarily my work as an ENT surgeon, because we work together. We have psychiatrists and psychologists who do a lot of that work for insomnia. Yes.
Yes, there is a question here. To some people, like it's normal, like for them to like take 30 to 35 minutes before they fall asleep, and some they have to create a fake scenario in their head so they can be able to sleep. So is it normal? Can you say it's normal?
So it's very interesting, because everyone has its sleep latency, the ability to fall asleep. For some people, it's very easy. As you said, hivyo wanaweza lala pahali popote. And others, they struggle. They really struggle. So what we tell such patients, that if you're struggling to fall asleep, then maybe there are things that you can do before to help you. So it is not normal to struggle, and usually struggling, we call it about half an hour.
Half an hour.
Yeah, half an hour.
So
Yes,
30 to 35
so 30 to 35 minutes. If you're really struggling, something could be happening that actually you're forcing yourself to sleep when your body doesn't want to sleep. So get up and do something. You know? Yes, yeah. It's very opposite of what we are told, that you should lie in bed and toss and turn. No, get up and try do something. Or try do something that is not very stimulating. But do not touch your phone. Do not touch your phone if you're struggling to sleep, because the blue light, your phone emits light, and part of the spectrum of light is blue light. It sends a message to your brain to wake up. So do not try, and when you try to fall asleep, don't get on social media. Don't open your phone. Those are some of the tricks that you can do. Yes, yeah.
So we can
and there are many others. Yeah.
We can say no TikToks.
No TikToks, no TikToks, no TikToks, no Facebook, no Instagram, no sending SMSs. Don't ruminate. There's a whole field of medicine called sleep hygiene. And I think we'll get into it, but it's some of the things that you can do to help you.
Yes. Yes. There's this about sleepwalking. It's mostly common. So why is it that it normally happens at night?
So sleepwalking belongs to a group of disorders called parasomnias, meaning you have things that you are doing when you're awake that occur at night. Sleepwalking, sleep talking. People are very worried. My secrets will be told. Nitasema kitu ambayo sifai kufanya, you know. And sleepwalking can be dangerous. Where you can imagine your household, you don't know what is there, you fall off, you break something. So sleepwalking is actually, it's scary, but it is not as common as we think. Even sleep talking as well. Most people who sleep talk, they talk gibberish. So si kitu ambayo unaweza elewa. Oh, yes, most people. But it does happen, parasomnias do happen. And usually it's an imbalance of some chemicals in the brain, but they can be treated with medication.
Yes, so most of the people have seen sleepwalking kids. And why is that?
And why is that?
Yes.
We don't understand why, but a lot of parasomnias occur in childhood.
Yes.
Sleepwalking, sleep talking, sleep terrors,
Yes.
nightmares, a lot of that occurs in childhood. And we don't understand why. We think it could be part of the developing brain, or it could be due to some traumas the child sees when they're awake, and they are not able to understand what is happening, and it manifests at night. Those are some of the theories, but there's nothing concrete that inatuambia kwa nini inaokaa kwa watoto. But you're very right. A lot of these problems happen to children. But the good thing is they outgrow them.
Yes.
That's good. That's good, yes.
Sorry, you talked about snoring. There's a question. Can you inherit it from someone, maybe your dad, your mom?
Yes, yeah. So, as I said, most snoring occurs in men, but the typical patient is usually a man who is a bit more elderly and who has a bit more weight on him. But more and more, we are finding younger men and even slim men and even slim ladies having that problem of snoring. And we think it's part of the problem with nutrition, diet, as well as activity. Most people are not very active. Now, can you inherit it? Yes. But it is not 100% that if your father snores or your mother snores, utaipata. So it is not 100%, but there's definitely an element of genetics to it.
Yeah.
And part of it is also just your anatomy and your physiology of your body.
So what will happen to someone if he or she goes for a long period of time without getting treated?
Without getting treated.
Yes.
So how we look at sleep disorders is that there are certain effects they have, and that's why for us it's no longer just about snoring and it's keeping me up awake at night. No. Part of the reason there are long-term side effects, especially the biggest problem being sleep apnea. The most obvious is that excessive daytime sleepiness. You are doing something significant like driving. So drowsy driving is one of the biggest causes, long-term driving. But it affects your brain, your heart, your lungs as well, and your metabolism. So your brain, you get a lot of neuropsychiatric conditions. You know, your mood changes, anxiety, stress, depression. And then it not only affects it, but those conditions affect sleep as well. So you find if you're feeling your mood is low, it'll affect your sleep. And if because your sleep is affected, it'll affect your mood. Those are some of the neuropsychiatric conditions. What about your cardiovascular? We find patients who have difficult to treat heart conditions, coronary artery disease, hypertension. Some of those conditions are made worse by sleep apnea. What about the lungs? You're breathing against the resistance. So then therefore for such patients, then their lung conditions become worse, your COPD and your asthma and whatnot. And your metabolic conditions like diabetes, they become worse as well. They become hard to treat, or the ones who are hard to treat even become what we call recalcitrant. Yani, we're giving you maximum treatment, lakini bado we're not getting the benefits. So sleep does affect a lot of your body system. And remember, because you sleep, and a part of the reason we sleep is to repair,
Yes.
to rest. So that's why it affects a lot of these things.
Yeah, so you're trying to say it's normal for people to have mood swings when they don't get enough sleep?
Yes, it is. That happens a lot. That happens a lot. Yes.
Yeah,
So mood swings, of course, mood swings can because there are a bunch of other things like kidney. Sleep disorders can be one of the causes of mood swings and mood changes. Yeah, that's true.
So I have seen some people, they say they have insomnia, and the best way to deal with it, some try to drink coffee. I don't know if it's advisable or something. So my question is, how important is it for individuals to seek medical help rather than trying to manage them on their own?
Yeah, so the thing about insomnia is that you have difficulty sleeping at night, and then you have excessive daytime sleepiness during the daytime. So you keep on taking coffee during the day to stay awake.
Yeah.
Lakini usiku huwezi lala. Now, it's sleep disorders. It's so important to get checked. If you do think that you have one, or your partner tells you uko na shida, and the reason is it's like a slow puncher. It'll get worse. You want to drive your car. If you think as life as a car, and sleep as the tires, it's a slow puncher. So you want to be optimum, because one of the problems with sleep disorders, it affects the daytime and affects your ability to act during the day, your judgment, your concentration, your memory, So those are things, if you work in a high pressure environment, you want to feel 100% or even 110%. So that's why things like sleep disorders affect. They don't just affect your daytime, they don't just affect your nighttime, they affect wewe usiku. So part of the treatment, as you've said, is coffee.
Yeah.
Unasikia kulala. Actually, what coffee does, there's a molecule called adenosine that builds up as your day goes on. And coffee, what coffee does is that it reduces that adenosine, so that at least you can stay awake. But the thing is that one of the things about coffee is that it works very well. It's a natural stimulant, but you have side effects of that as well. So we tell patients, please come and get seen by your doctor, your physician, whoever you feel you're comfortable seeing. Yeah.
So talking about treatments, are there any lifestyle changes or habits that can help improve the quality of sleep?
Oh yes. So there's this thing that we call sleep hygiene. We're in the era of taking control. You can take control of a lot of the things that you can do in your life, including sleep. So sleep hygiene are some of the things that we say that unaweza saidika. Having a regular schedule. So going to bed at a regular time and waking up at a regular time, including weekends. I know I'm not very popular nikisema hivyo, and the reason for this we find a lot of you are very ambitious people, hardworking. You'll work long hours during Monday to Friday, and then what happens Saturday, Sunday? Nalala sana, because you're saying that I want to catch up on sleep.
Yeah.
You know, for the busy Nairobi individual ambayo, so that's what most people do, and that is actually the wrong thing, because you should have regular. It should sleep. You're going to do sleep every day, so you want regular sleep times, waking and sleeping. So that's one of the things in sleep hygiene. Of course, you can vary it by about an hour, so plus or minus an hour. Another thing is to try and get into the mood of sleeping. And this is especially for people ambao have difficulty falling asleep. So you want to put your thoughts to bed first before ulale, you know? You want to have a warm bath or a warm shower before ulale. Your sleep environment must be neat, must be quiet. It must be dark. You have to switch off your lights. That's why we like, if you have trouble sleeping, your curtains, we urge you to have thick curtains so that the light doesn't pass through. We urge you to have a quiet environment. If you like meditating, or if you like reading certain phrases, if you're religious, do your prayers before, because it calms you down. You know, what you want is for your body to calm down before you get into bed. Because a lot of problems with insomnia is that you're trying to calm down when you're already in bed. Your thoughts are racing. Uko na mafikiria nyingi sana. You need to remove that and put them somewhere else. We urge, we're in the era of social media, we're in the era of mobile phones, we're in the era of TV. That light that your mobile phone inatoka, that light that your TV produces, it hits your eyes, goes to the back of your eyes, and alerts your eyes and tells your eyes it is daytime. It's called blue light. And there's a very big campaign. And if you notice, your phone has something called sleep mode or dark mode to reduce. The companies know it, and people have lobbied to have it so that you don't put your phone when you're going to sleep, because basically you're telling your brain that it is daytime because it produces the same light. That blue light produces the same light. Other thing, if you are a coffee drinker, don't take your coffee past 3 p.m. So usifike nyumbani, unataka kulala, unachukua kahawa. Okay? If you want to nap, there are patients who like napping, or there are people who like napping. They're not even patients. And I'm always asked what my thoughts are about napping. A nap should be about 30 to 45 minutes. And you should not nap close to your bedtime. So we urge people not to nap past 4 p.m. You know, because what happens, there's something called sleep pressure. The longer you're awake, the higher your sleep pressure. When you nap, your sleep pressure goes down. That's why you feel very refreshed. Unasikia, yani uko na nguvu after you take a nap. The problem with that is that your sleep pressure imeenda chini. If you do that very close to your bedtime, you find very difficult to sleep. Of course, another thing I'm also asked is mattress. What sort of mattress you should have? But the type of mattress is very individual. Very individual, sorry. Whether it's a soft mattress, a hard mattress, it should be comfortable. There are people who like soft mattresses, there are people who like hard mattresses. For the orthopedic problems, it doesn't matter. As long as it is comfortable, and you can sleep. Yes.
So, doctor, you said something about sleep hygiene. Yeah.
That all of that is sleep hygiene.
Yes, you said dark room. But I see some parents, they prefer when the kids sleep when there's light on. So is it going to affect them in the long run?
Not in the long run. Sleep is very individual. Of course, that's a general statement. Some children have night terrors, nightmares, or they feel safer
When they have lights on.
when they have a light on when they're going to sleep. So of course you do that for your child. Wacha lale vizuri. Akilala, unazima.
But some, they wake up.
They wake up, yes, and they feel, so it's a very tricky situation because you want, the child must be comfortable. And the comfort of the child, if the comfort of the child is a light, but I'm not talking about a bright light.
Yes.
Something to just show comfort. You know, we call it soft light, because there's also a harsh light. You will not put the camera, you will not put the light for a studio like the one that we have here, no. But you'll put a very soft light, yes. And the softer the light, the better.
So it's okay?
So it is okay. It is okay.
Even
but
for
a soft light.
Yes, even for adults.
Even for adults, if you feel more comfortable with a light on, have a bedside light that is very warm. But you know, when I say warm, I don't even mean bright. I mean warm colors. You can have a very soft red, a very soft blue, you know, those nice colors.
Yeah, so like we were talking about lifestyle. So what does stress and anxiety play in the
part? Yeah, so those stress and anxiety specifically, they affect specifically insomnia, and you'll find that the thoughts in your brain will manifest at night, will make it difficult to fall asleep, and we find that poor sleep will increase your stress, anxiety, worry, and that, if it's not corrected, can even lead to depression as well. So good sleep can affect that. But also stress and anxiety affect your sleep. And we all know, the night before an exam, ni ngumu sana kulala. Ni ngumu sana. We've all been there.
Or even going for a trip.
Or even going for a trip, or doing something new and exciting. It may not even be bad stress. You might be traveling somewhere, hujawahi enda Mombasa, and you're looking forward, umesha pack, umeshaweka costume, umeenda YouTube, umeangalia 10 things to do in Mombasa. Hiyo siku, I can bet you hautalala. That excitement will also affect. But so that means your daytime affect. You know, your thoughts, your emotions, your feelings will affect your sleep as well. But don't take it too hard on yourself. You will be able to recover, and it'll be okay. Yes.
So we've talked more about insomnia. So why do you think most people are being affected by it, and what age they are mostly affected?
Yeah. So we find the younger age group is affected. So young people are affected. Females are more affected by insomnia. And of course, the type of job and anxieties that go through is affected. So those sort of things affect, and you want to try and deal with the underlying issue. You see what is wrong. So when we come, how we diagnose sleep disorders is you take a thorough history. So unauliza mgonjwa, okay, what is the problem? You look at you ask a lot of sleep questions. So the first thing to do to diagnose is to take a history. The second thing to diagnose is what we'd call a physical examination, nangalia. So for us as ENT surgeons, we're very interested in this because problems of the nose, problems of the throat affect your snoring and sleep apnea, or enlarged necks, you know, high BMI, such things. We're looking out for those things. And then we send you for some tests. What tests do we do? we can check your general well-being, kama damu iko sawa, kama thyroid iko sawa, your kidney, your liver. You know, those things can affect whether a general medical illness can affect your sleep. But specifically for sleep diagnostics, there's something that we call a PSG, polysomnograph. And that looks at very many things. It looks at your brain waves when you sleep. It looks at your breathing status, how much breath that you remove from your nose. It looks at your snoring status. It has a microphone to tell how loudly you sleep. It looks at your eye movement because sleep is divided into certain sections, stage 1, 2, 3, and then REM sleep. So it is able to tell. It looks at your when you sleep, your breathing status, because that tells us about sleep apnea. So it tells us whether you're breathing well, so and whether there's synchrony between your abdomen and your chest. It tells us about your heart status, so your ECG and your pulse rate. And for those people who move a lot during sleep, we have muscle analysis. So we check your leg movement as well. So all those things combined is a polysomnograph. And they give us a lot of information, what type of sleep disorder you may have and what we can do about it. And for us who deal a lot with sleep apnea, it can tell us your apnea-hypopnea index, your AHI. And anything above 5 for your AHI tells us that that you may have a sleep apnea problem. And it could be mild, moderate, or severe. We've gotten patients who have AHIs even above 30. And we really worry about such patients. Yes.
Dr. Quick question before we go to treatment and medication. So there are some people when they sleep, their eyes are open, they open their eyes. Right? So is it normal or what causes that?
So when we sleep, we move through different stages from light sleep to deep sleep and then to REM sleep. So stage 1, stage 2, stage 3, and then REM. And then it goes back. And it cycles like that every 90 to 120 minutes for about 4 to 5 sessions. So actually, you go through like that, stage 1, 2, 3, and then REM, and then back. Now, during REM sleep, that's a part of sleep where we dream. We don't know why we dream. There are many theories. One of the theories is that our brain is trying to organize what you've gone through during the day. The other theory is that you dream because you have unresolved conflicts. So your brain iko na shida and it just needs to resolve it. Other things is that we dream because we are our brain is developing, you know. But to prevent our body from acting out on our dreams, because if a lion is running after you in your dream, your brain doesn't know that it's not a fake lion. So your body is paralyzed. It paralyzes itself when you're dreaming. During REM sleep, it paralyzes itself. So there are only very few muscles that work during that period. Your eyes, your heart, your diaphragm, which helps you breathe, those 3 muscles. So it's a very odd situation, but it prevents you from acting out on your dreams. Otherwise, you'd be kicking, you'd be moving your legs, you'd be moving your arms, you'd be running during your dreams. So what that means is that your eyes move during REM sleep. So sometimes that's what relatives wanaonaga. Your eye is moving, but it's REM sleep. Yeah.
Yeah, so when we go to treatment and medication, so are there any natural remedies that someone can use, or you have to specifically go to the
hospital? Yeah. So, I mean, the natural remedies are sleep hygiene. You have a lot of control. You take a lot of control. So once we diagnose you, we say, okay, you may have this sleep disorder, you may have sleep apnea, you may have insomnia. What treatments are available. Of course, it depends on you, but it also depends on the type of sleep disorder. Let's assume it's insomnia and you've been going through a tough time. Well, something as simple as counseling or psychiatry or medication as well to help you sleep. If it's something like snoring or sleep apnea, what options do you have? Remember, you said sleep apnea is collapse of the airway during sleep.
Yeah.
So there's a machine called a CPAP machine that you wear at night. It's a mask connected to a machine via a pipe that blows in air that keeps your airway open. Works very well. There are other treatments like surgery or even dental devices. So all those. So now that's where we come in as ENT surgeons, because we're able to direct you and say, okay, this is the diagnosis and this is the treatment. If it is surgery, we do surgery. And we do a lot of surgery for snoring. It occurs a lot in children. Big tonsils, big adenoids, we do that, and the child is treated. For adults, a bit different. The palate, the base of tongue, tonsils, adenoids as well, deviated septum, we do septoplasties, polyps, shida ndani ya mapua, turbinates, large turbinates, problems that occur in the nose, problems that occur in the mouth, we do surgery on those ones as well.
Speaking about meds, some people, when they are experiencing this sleep disorder, they can't sleep, they can just decide to walk in at the chemist and they get Piriton. To some, it does help. So is it advisable, or do we have we must come to the hospital and get checked?
Yeah, so what I would urge people is, don't be afraid to come to a hospital. Don't be afraid to come to a doctor and say, I have trouble sleeping. And the doctor will be able to go through your history and physical examination to find out. Now, there are many sleep aids. We call them sleep aids. Some medication, the side effect is to sleep. So that's what you've just mentioned right now. Some medication is dedicated to sleep, and others, we try and enhance the body's own natural molecules. One of those molecules is melatonin. So melatonin is produced, it's a molecule that is produced before you sleep, maybe a few hours before you sleep, and it starts rising. And it helps you sleep. And that's one of the natural molecules that people get over the counter. But I urge, it has not, I won't say it has been abused, but I urge people to have a medical advice, because you might be thinking it is insomnia, but it's something else. You might be thinking that it's something as simple as stress, but it's... So I always urge, go to your doctor, go be seen, be told, okay, this is the treatment that is best for you. Actually, this is not the problem. You have problem sleeping because you have a large prostate and you're urinating a lot, or you're waking up a lot to go urinate. So we need to treat your prostate problem. Yes. So I urge people, don't be afraid, conquer your fears, go to see the doctor, the clinician, onekane, and they'll be able to guide you on what needs to be done. But yes, sleep aids sometimes are abused. Yeah. So my message is, don't abuse sleep aids.
Yeah, so before you administer the drugs to someone, so what are the most common tests that you do in your center?
Yeah, so we do two things, blood works and and we perform the PSG. So we look, is there a problem with your blood? Is there a problem with your kidneys? Is there a problem with your liver? Is there a problem with your thyroid? Or any other thing that during the history and examination, we can detect. Those are the big things that we look for. And then if need be, we can perform the PSG. So a PSG is a test, an overnight test, where we hook all these things and get the answers. So it's an overnight test. You sleep over, and we get all this information that tells you. And I'm sure you'll be taken around to see how we do those PSGs. Yeah. But it's basically blood work and a PSG.
So after the test, so what do you look for people?
So after the test tells us how long the patient has slept, if there's any snoring, if there's any apnea, if there's any leg movement, how low the oxygen has been during sleep, because that can be a problem. How have they been going through the stages of sleep as we think they should, from stage 1 to stage 2 to stage 3, and then back through REM back to stage 1. So with all that information, we'll give you the diagnosis and we'll tell you this is the treatment for you. Yeah. So the test tells us a lot of things, but we need you to sleep.
So how long does it take for
It takes
patients to experience changes after they start treatment for their disorders?
So let's assume it's something as simple as you're snoring because of large tonsils. We remove the tonsils, you heal, you get back to better. Let's assume that your treatment needs CPAP, it's immediate. You start putting on your CPAP machine, it's immediate. The effects are immediate. But some of them take much longer. If it's insomnia, you need to go through the counseling so that we can get to the root of the problem. And even then, you as the patient need to be, you need to accept the diagnosis and internalize it. So that takes a bit longer. But if we've hit the right diagnosis and hit the right treatment, there's a journey towards treatment. Some of it is immediate, some of it takes longer. But whatever it is, the expectations from the patient, and we as doctors, one of the things as doctors we sometimes fail in is match the patient's expectations. So the patient, anafikiri, it'll be instant, but it'll take longer. So we need to match expectations as well. So it depends on the diagnosis.
So the treatment, we can say therapies, it helps.
Yeah, therapies help, yeah. Therapy helps, physiotherapy helps, diet helps. One of the things is losing weight. We tell patients, lose 10%. If you can lose 10%, then it helps a lot. Some of it is dose dependent, meaning that the more you lose, the better your sleep. Some of it is threshold dependent, kumaanisha that there's a limit. Beyond that, there's no much more benefit, but there's a lot of help with diet and nutrition and exercise as well. So those are the three things, yeah.
So for someone that has sleep disorders or maybe is experiencing and is hesitant to seek medical advice, so what advice do you have for them?
I will tell them, number one, conquer your fears. There's a reason. Is there a reason why you're afraid of coming to be seen? Maybe you had a bad experience in a hospital, or labda ulisikia somebody else, a family member, had a bad experience, or maybe you're scared of what you will find. Maybe you're not ready for the diagnosis, or maybe you already know or you suspect the diagnosis, but you're not ready to commit to the treatment. We see all sorts of things. Miseducation, where umeambiwa kitu moja and it is the farthest thing from the truth, But I believe in science. I believe in truth. I believe that, the best way to tackle something ni to tackle it head on. You know what it is, and these are the options. This is good options, bad options. Now we're in the belly, and you tackle it. That's the best way. Conquer your fears and tackle your diagnosis. Yes. But to those ones, conquer your fears. That's what I'm telling.
So, Dr. How does the existence of more than one illness, let's say diabetes and heart disease, affects the treatment of sleep disorders?
Oh, it makes it a bit more difficult. It makes it more complicated because you're dealing with many parameters. So let's assume something like hypertension, diabetes. You have to treat that condition together with your sleep disorder, and what happens is that they affect each other. So it becomes a chicken and egg. What comes first? Should I concentrate on your diabetes or should I concentrate on your sleep? And most of us, as doctors, that's why we work as a team. So that let me concentrate on this, and then the diabetic doctor concentrates on this, and we find a common ground. But it makes it a bit more difficult. So, but if we work as a team, we're able to get to the bottom and treat. Inakuanga ngumu.
So we said some people some people they're scared
Yeah.
of going to the hospital to
Or
to
the
get
clinic,
checked,
yeah.
or clinics. So do you have any awareness or awareness campaigns related to sleep disorders, like to just that
Yes,
you'd like to highlight?
Yeah, there's some sleep, what do you call them? Sleep Awareness Week. We celebrated it this year, and it was good. One of the other ways is to educate health workers, and this is through webinars, CMEs, and also educate insurances as well, to show that this is a real problem and it needs to be tackled head on. If we don't tackle it, we get negative outcomes. So there's a lot of webinars and outreaches that we try and do, and this is part of it as well. Try to get the message out there that hii shida ni ya ukweli, lakini kuna matibabu. Yes.
So as we wind up, Dr. So the cost of treating sleep disorders, can you say that anybody can be able to afford? Or
So the sleep disorders, it's a new condition. So new technology has come out. The new technology is reducing the cost of diagnosis and treatment. So traditionally, it has not been available to everyone, this sleep disorder treatment, but new technology is bringing it down. And we hope that in the future, it can be rolled out. We're in the era of algorithms, we're in the era of artificial intelligence, we're in the era of new devices to be able to detect, we're in the era of digital medicine. So a lot of things are moving very fast. So it is becoming much more affordable. And we thank all the partners that are in this effort to try and make it more affordable, including insurances as well. Yeah, a lot of insurances are jumping on board, so it is good.
so, but are we safe to say that the cost affects the way the number of people that turn out to get treatments and stuff?
Yes, it can be, and some of the treatments are expensive, but it's one of those things that sleep affects your entire life, because you sleep every day. So a one-off treatment may help you the rest of your life. So that's how I think about it. That some of these things, if it's going to affect the rest of your life, then it is worth it. And we are trying our very best to try and reduce some of these costs. Yeah.
So as we finish up, Dr. Your message to someone watching us when it comes to maintaining a healthy sleep pattern?
Okay. So number one, sleep is super important. I would urge you to maintain and develop a good sleep hygiene routine. Sleep hygiene is the key to both wellness. It is the third leg of wellness. The other two legs are diet and exercise. So that is to do with wellness. But sleep is also important for your health, and don't take it for granted. And if there's any issue, please consult a doctor or physician, get seen, and don't be scared. And we are here as your partner. Asante sana.